on the NewsChannel 5 network. This is Open Line.
Hello, everyone. Welcome to Open Line. Glad you are with us. It is Tuesday, July 14th, and we are talking about the surge in coronavirus cases. Monday was the state's highest single-day increase in cases since the pandemic began. And so we're going to be talking about that. Cases are increasing, hospitalizations are increasing. And I know there's some people that have questions, that may be skeptical, and we want to give you a chance to ask questions and to learn some stuff tonight as well. Happy to have with us Dr. Aaron Milstone. He is at Williamson County Medical Center, a pulmonologist there. So we will be talking to him via Zoom, and also Isaiah Whalum. He is a COVID-19 survivor. So I'm going to turn to Zoom now, and there they are. Look at that. Not beside me, but in Zoom, via Zoom. Thank you both for being here.
Thank you.
Thank you for having me.
All right, Isaiah, I want to ask you some questions in a moment because I'm fascinated about your story. You were in the hospital for over 50 days. I'm glad you're okay, but I want to hear about your experience. But Dr. Milstone, first you. What are you seeing? So I just said Monday, the single highest day of increases since the pandemic began. Is that because we are testing more, or is something else going on here?
No, I think you're seeing the effect of really failed leadership in terms of not encouraging the society to take the right steps to stem the worsening of the pandemic. And for the last 2 weeks, I've been covering our COVID unit and our non-COVID unit. And here in my county, we've seen a dramatic increase in admissions to the hospital for COVID patients, a dramatic increase in patients going to the ICU. And it's not just Williamson County, it's happening all over the state. It's happening in Shelby County, it's happening in Hamilton County, it's happening in Knox County, and it's happening in Davidson County, but it's also happening in your county. I think if we do not take the right steps quickly, it is highly likely that our state will look more and more like the state of Texas or the state of Arizona or the state of Florida. And if we don't intervene now, all of the work that we did with the stay-at-home order, all of that, which worked, it slowed the spread of COVID-19, it bought us valuable time as a state to address the health crisis. But if we don't do something radical now, we are going to lose and undo all of that good work we did over the last couple of months.
Another thing I'm hearing is that the death rate is down. So there are more people going into hospitals. We're seeing hospitals get fuller here in Davidson County, and I guess where you are. What about when you hear people say, well, the death rate is going down again, as if this is something to be taken less seriously?
Well, I have two comments about that. One is you would hope that 6 months into the crisis that physicians and healthcare workers have learned a few tricks. So we've gotten better at taking care of the sick. So we really have made some advantages. We've brought remdesivir, an antiviral drug, quickly to use. We now are using a lot more steroids than we used to. We're using plasma transfusion from people that have recovered from COVID-19. So one is we've gotten better at taking care of COVID-19. Now, that being said, when you start to see numbers rise, it follows a pattern. You see an increase in cases. A couple weeks later, you see an increase in hospitalizations. A week after that, an increase in ICU admissions. And then multiple weeks after you see that rise in cases, you begin to see the death rate going up. So what you're seeing in Arizona and Florida is first they had high numbers, then they had high numbers of admissions, and now in the last couple of days, you're beginning to see a rise in the death rate in states like Florida, Arizona, and Texas. So those are two comments. And then my final comment is, if you say just 1% die from this illness, just 1% of the people that get sick with COVID-19 die, that doesn't sound all that bad. But imagine if half of the state of Tennessee, a population of 7 million, say 3.5 million end up with COVID-19 over the next 2 years. That 1% of 3.5 million turns out to be thousands and thousands of deaths just here in the state of Tennessee. So you have to take it in context. 1% death rate doesn't sound bad, but if half of the population ends up with COVID-19, which is likely, that death rate is going to be a very, very large number over time.
Another thing I've heard, doctor, is people will say something along the lines of, well, we just need to get herd immunity. That at some point this is very contagious, everybody's going to get it, let's just get herd immunity and kind of move on with things. Please address that.
So herd immunity is the idea that you want to get the infection and spread the infection so wide and vastly that there aren't that many people left that have not had the infection. But the problem with COVID-19 is that this is a brand new virus. We know very, very little about antibodies related to COVID-19. In fact, just this week, there was a fairly large study out of Europe that showed many people that had proven COVID-19 lost their antibodies over time or failed to develop antibodies over time. And coronavirus, COVID-19, is a lot closer to an influenza virus. And remember, if you had the flu last year, that does not mean that you will not have a different strain of the flu this year. And so my biggest worry about the idea of herd immunity is that we really are not sure whether or not the antibodies are protective or how long they last. And now you're starting to see reports, not just here in the US, but elsewhere as well, of individuals that had COVID-19 once, and that those individuals are getting COVID-19 again. Not a week later, not a month later, but multiple months down the road, we're starting to see people get a second infection. And again, I think the idea of herd immunity is dangerous because the virus is dangerous. And we just, again, when we have something novel and new, we have to give science a little bit of a break because we're learning constantly, not just about herd immunity, not just about antibodies, but better ways to treat the virus. So I take the idea of herd immunity with a grain of salt.
Well, and that's very distressing to hear that there may be people getting it a second time. We are now in the summer. What is your concern as we are in these warm months and we're seeing the cases go up? What is your concern about where we may be come the fall and the winter?
The problem is that 90 days from this week, the state of Tennessee will enter the flu season. So in about 90 days, you're going to be beginning to see cases of influenza A and B. And every year, flu hospitalizes a fair number of Tennesseans. And it puts a fair number of Tennesseans in ICU, and a fair number of Tennesseans die each year from influenza. Right now, hospitals are stressed. Hospitals throughout the state of Tennessee are seeing larger numbers of COVID than at any time since the pandemic began. All right. In fact, at our own hospital, we're really at an all-time high in terms of COVID-19 patients at our facility. Imagine the stress in 90 days when we're not just dealing with COVID-19, but we're also dealing with people suffering from the flu and other viruses that circulate in the fall, like RSV and parainfluenza. So my biggest concern is not just this week, but 12 weeks from now, when we're really stressed and we have that additional burden of flu cases coming into our hospitals stay.
And Isaiah, I want to get to you in a moment. I'm going to ask one more question here of the doctor. School is getting ready to start for many districts. Davidson County is going to start for the first month remotely. There are many private schools that are not. I believe Williamson County, is not. I can't be certain. You're in Williamson County. What is your recommendation? And I know it's a very personal sort of thing for parents. What is your concern? What should parents be thinking about as they make this decision, in some cases, whether to send their child to school or keep them home and do remote learning?
As a physician and a parent, I'm worried. I don't have the answer for this question. I don't think any school teacher, any superintendent has the right answer for this question. It really gets back to the idea that it's an unknown. We don't know how easy it is for children to transmit the virus to adults and vice versa. And I really think that schools should not really resume until our governor and the federal government have first adequately addressed the health crisis. And we can guarantee rapid and regular testing, and we're not there. We can guarantee that we effectively contact trace and find people that have been in contact with other people that have had the virus. And we have to really follow through on masks, physical distancing, frequent hand washing. These safety measures have to be in place. And if they're not in place, we're going to see a lot more avoidable cases, hospitalizations, and even deaths from participation in our schools. I think we have to work together with our school systems and protect our children, protect our teachers, protect our families. And again, I don't have the definitive answer for this very difficult question. I just know personally as a parent that we really need our federal government to adequately address these issues before our kids go back to school in the fall.
And you've called on the governor to call for a statewide mask mandate. Is that right?
That is correct. We believe now through science that wearing a mask is one of the only interventions we have left. We don't have a vaccine. We have drugs that work somewhat, but we're also seeing a fair number of individuals die even despite the antiviral drugs, steroids, giving them plasma transfusions. So what are we left with? We're left with 3 proven ways to slow the spread of COVID-19. And those 3 ways are staying physically separated, the idea of 6 feet apart, frequency of hand washing, so washing your hands frequently, and wearing masks. And unfortunately, instead of leading in crisis, our state governor's most recent executive order really puts the responsibility on county mayors to lead. And that in turn tied the hands of a lot of city mayors who want to do more to protect their citizens. And so we have to get behind the idea of wearing masks. You've seen in the last week, our president, our vice president, and many, many legislators and Congress, both at the state and the national level, starting to get the idea that masks may be the only intervention to slow the spread of COVID in the United States. We're one of the world's most advanced industrialized countries. And unfortunately, our data mirrors many third world countries like Brazil, Chile, Peru, where death rates are very high and where the spread of COVID seems unchecked at this time.
Is wearing a mask, I think what the governor is saying is he's concerned that in some of these more rural counties, maybe in Davidson County, perhaps Williamson County, where there's high density, they should wear a mask. But in more rural counties, that's a tougher call. What would you say to that sort of concern, that it's tough to put this mandate on more rural counties where there's not the high density? You think it's time to do that?
I do. I think if you look at our state over the passing of time, when the pandemic was young, just a few months ago, many of those rural counties did not have a lot of COVID. Now, if you look at those state maps and you look at the number of positives and you look at the number of deaths, most of the rural counties now are seeing a fair amount of COVID. Now, those patients may not stay in the county when they get sick. They may be shipped to tertiary care centers in Nashville and Memphis, in Knoxville and in Chattanooga. But the idea of this being a big city or a big county problem rather than a statewide problem just doesn't wash when you look at the data. And I think we have to realize that we are all in this together. We are all Tennesseans. We are all Americans. And the time for politicizing the pandemic, we've got to put that to the side. We have to let policy define where this pandemic goes and not politics. Many people say to me, well, how can you demand a mask? How can you make a mask a requirement? My answer to that is our government does all kinds of requirements and mandates. I mean, look at speed limits. Speed limits are those that are there to protect the lives of others and fine those who ignore them because they speed recklessly and endanger the lives of others. look at the smoking requirement in our state. When the no smoking requirement came out for the state of Tennessee, that you could not smoke in a restaurant or a public place, we were furious, because why would you do this to us? But the reality of it is, those no smoking laws protect the life and liberty of everyone else to breathe clean air and avoid endangering children. They help to avoid endangering others with secondhand smoke. So just like speed limits, just like seat belts, just like smoking cessation laws, really, at the end of the day, we have to have the decency to try and protect our brethren.
All right, I want to talk to Isaiah now. Isaiah, thank you for being with us. You spent 53 days in the hospital, right? 53 days. You're 46 years old, 53 days in the hospital. What do you say to people? Yeah, and you're young. I'm going to say 46. What do you say to people that remain skeptical about this whole thing? What do you say?
I have to say a few simple things. It's real. This is not a game. Arguing about mask, as Dr. Milstone, he's right. You know, we certainly, as an individual, I was in the beginning when we were just hearing about COVID-19, but looking at it from that point of view as it was spreading in other areas of the world, I was not of the notion that I would be counted in that number of people getting COVID-19. Now, that was not me not taking it serious, but again, it seems so far away. But now I'm recovering from COVID-19. There's no way that I would chance not protecting myself, my family, my neighbor. It's just the moral thing to do.
The moral thing to do. How do you feel like, what were your first symptoms, and do you have a sense of how you got it? Do you know where you got it?
To be honest, I have no idea. I just started remembering the weeks before I got sick, and I can tell you that I wasn't feeling 100%. It was like maybe I had like a cold, or maybe the onset of the flu. But I was taking different medicines, so it was kind of curtailing that feeling. But I can tell you this, when it kicked in on me, it was very rapid. It did not delay. There was no warning sign like, oh my gosh, you're about to get sick. It hit me, and from there, it was a very rapid decline. Of course, Dr. Milstone could fill you in more on that medical part once he encountered me, but I was very sick, and it took no time. It was in a matter of days. The first thing I remember getting sick was the fever and the chills, and then everything else ensued after that, and it was a rapid decline.
Do you remember the decision to go to the hospital?
Very, very much so. It was after getting the COVID test at a clinic actually in Franklin, that's down the street from Williamson County. I took the test, they sent me home, and they said, we'll be in contact. That was like a Thursday. Saturday, I was called and they told me to come back to the clinic because I tested positive for COVID. But at that time, I was feeling very bad then. So we got India got me to the hospital, the clinic actually, and the doctor was waiting for me in the lobby area of the clinic, which we thought was odd, but she remembered when I came previously that I was feeling very, very bad. So once we walked in and she laid eyes on me, she said, I'm going to go ahead and call the hospital, and I want you guys to go to the hospital because he's not doing well. And so we left the clinic and made the short drive to Williamson County Hospital. And from there, the awesome team there, they just took a great care of me.
They took great care of you. I'm glad to hear that. And describe what it was like, what you remember, what it was like in the hospital, because you're not able to really be around your family. It's I'm sure bizarre, but what do you remember? What was it like in the hospital?
Well, when of course getting there and being whisked down the hallways to the COVID unit, you know, there was an air of uncertainty, like, man, what's about to happen? I mean, this isn't the flu, it's not the measles, it's not the mumps, it's not chicken pox. This is new for everybody. But I think the reality set in for me, of course, seeing everybody in the PPEs and all the precaution that was being taken. I remember my first couple of days in the COVID unit just wondering, like, what's going to happen? Like, what's the next thing? And so there was really not, that's the most of my memory. Of course, I can kind of laugh about it a little bit now. I remember Dr. Milstone's colleague, Dr. Assad, coming in to see me. And he came in and he was very straightforward. He sat on the stool beside the bed, rolled it up, and he said, Mr. Whalum, I have some serious news I need to talk to you about. And I said, well, doctor, just give it to me straight. And he said, if I don't intubate you, you're going to die.
Wow.
And so at that point, you know, it's surreal and real at the same time, you know? And he explained to me the reasoning. He said, as Williamson County's COVID team has had a chance to treat COVID patients and watch the rest of the United States care for patients, they've just learned some things that they gleaned that would make my survival better. One of them being, if they went ahead and intubated me early, it would give my respiratory system a chance to rest, and then they would be able to do other things to get me through it. And of course, I wish I could sit here and be on my chest like I was Superman, but fear came over me. Because having worked briefly in the medical field years ago, and hearing that word intubation, you know, you think, oh, the worst. You think the absolute worst is about to happen to me. So when Dr. Assad said, well, that's what we have to do, I said, well, now we need to kind of think about something else. What are my other options? And he was like, Isaiah, there is no other option. And at that point, he said, I think you should call your wife, India, and talk to her. And little did I know that I had already given her permission to make medical decisions for me at that particular point. So he had already called and explained to her what needed to happen. So it just kind of let me go through the motions. They were going to do the right thing anyway. And I'm so glad that it was done. My final memories outside of that was, I remember the anesthesiologist telling me he was about to give me more medicine than I probably had ever had in my life or will have. And from that point, it was a brief moment to where I could still hear the medical team talking. But after that, I have no recollection other than what was told to me by the medical team.
That's chilling. And how long were you on How long were you intubated?
And I want to say 3.5 weeks. Is that correct, Dr. Milstone? 3.5 weeks?
That is correct.
Wow.
3.5 weeks on life support, essentially.
Yeah.
My goodness.
So, yeah, the saving grace in it is that I don't remember the pain. I don't remember, I've started to have some brief memories, like I remember having this crazy dream where I was being held hostage in a fried chicken restaurant. Maybe that's because I'm a chef. I don't know. But other than that, my memory starts coming into play in that time where the team started waking me up, bringing me out of the coma. I just remember the medical team, the nursing staff, there's just the little things that they were doing to help me through it.
I am so glad. I'm so glad you're okay. And I want to ask you, Dr. Milstone, about I guess some of what we could learn from Isaiah's case. But we're going to take a break, and then we'll start also taking calls. If you're on the line, hold on. Stephen, others, hold on. And if you want to call in, there's a number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.